Good evening, everyone, and welcome to this extremely interesting panel discussion that we have lined up on our Swechha India Facebook page for you all today. I hope everyone in their respective homes are doing well and are staying safe. I know these are extremely difficult times and very, very tough times for all of us, and we're all braving through it. Um, just before we get into this panel discussion and we introduce you to our panelists today, as well as the moderator for this discussion, I want to quickly run you through a little bit about why we're doing this, what is the purpose behind doing this, as well as how this entire idea of doing this panel discussion came into existence. So this panel discussion that we're having here today is actually part of a larger digital campaign that is being run right now by the Queer Muslim Project, which is a wonderful organization working on ground for queer Muslims. So it's the project. The digital campaign is called #COVID Kindness. You can also check that out on their page itself. They've been running different portrait series. They've been doing Instagram lives, and also this panel discussion that we have here today for all of you to actually discuss the LGBTQIA community on ground and how this COVID crisis has actually affected the community and what's actually happening in terms of leadership by this community on ground. So this project COVID-19 COVID kindness is actually part of a larger project that Swechha has been running in collaboration and partnership with the US Embassy this year. It's actually a restricted project for all of the alumni who have been part of program exchange programs as part of the US Embassy. And this is one project that has been undertaken by one alumni from this network. We actually had over 100 alumni given different projects related to youth, women empowerment, environment, education, pluralism, tolerance, inclusion, and entrepreneurship. So a wide variety of different topics that we wanted to cover through these different micro scale projects that we're running across the entire country. And one of the alumni who was selected for this project, she is actually her name is Wafa Hamid, and she has been working on ground with the Queer Muslim Project in running #COVID Kindness for the last couple of weeks. So without further ado, I want to actually introduce you to our moderator for the session, Rafiul, who is actually the founder of the Queer Muslim Project. And he currently represents India on the Beijing 25 plus Global Youth Task Force, which was set up by the UN Women to strengthen gender responsive action and to achieve the 2030 Sustainable Development Goals. He's also been nominated by the Hindu Business Line in the year 2018 as a young change maker. And he brings with him a decade of experience in actually working with issues related to gender and sexuality rights. So I'm going to leave it to Rafiul now, who will introduce you to this panel discussion and also what we're trying to discuss through the discussion, as well as introduce you to the panelists that are here today. Over to you, Rafiul.
Thank you so much, Ashim. Hello, everyone. Thanks for tuning into the session. So the topic for today's discussion is LGBTQIA plus leadership in times of COVID-19. And as Ashim has rightly pointed out, that this has been challenging times, and especially for the queer community in India, where we have heard news of and read about people being, kind of in isolation with either in isolation or even with abusive families, and generally the mental health stress and anxiety going up. But what we have also seen is that a lot of people are finding resort on the internet, really using the internet to their advantage for creative self-expression, community building, kind of accessing interesting information. And today I am happy to share that we have with us an amazing bunch of activists and community leaders from the community who have been at the forefront of some of the interesting advocacy work that's being done at this time. So I would just like to go ahead and introduce our panelists for the day. So we have with us Rituparna Borah. So Rituparna is the co-founder and co-director of Nazariya Queer Feminist Resource Group, and she brings with her over 15 years of experience in gender and sexuality rights organizing, and she's based out of Delhi. We also have with us today Grace Banu. Grace is a Dalit transgender rights activist from Tamil Nadu and also the founder of Trans Rights Now Collective. And she's been actively involved with trans rights organizing, especially in rural Tamil Nadu. We have Anish Gawande. Anish is a writer and translator. He's the director of the Dara Shiko Fellowship and uh, is also the co-founder of the Pink List, which is India's first queer political archive and has been doing some really amazing work, especially at this time. So without taking much time, I will move to our first speaker for the day. So my question is to Rituparna.
Hi, Rafiul.
Hi, Rituparna. So how do you think the COVID-19 crisis has affected your work? What has changed? I mean, what is the change that you see currently?
Okay, first of all, thank you for having me with you. It's always lovely to speak with you. COVID-19 has been a threatening life experience for queer people and trans persons. So one of the things that we have noticed uh, in our calls to Nazariya that they have been increased. Earlier we used to get calls in our helpline number like 2-3 calls a week. Now we get 12 to 14 calls a week, which is considerably high. And the kind of things that queer people and trans persons have been sharing is quite scary and quite sad also. One of the things that they have been sharing is the kind of surveillance that is there in the household. So surveillance, for instance, the surveillance is genuine, not liked by many people, but for queer and trans persons, surveillance is something that they have been living with surveillance for their lifetime, throughout their lifetime. What to wear, what to say, what not to say, how to behave in front of relatives, how not to behave in front of relatives. Now, in terms of surveillance has increased considerably during COVID time because parents, they are locked down with most of the queer people who are living with parents and biological family have been locked down with families. Secondly, in terms of surveillance, it might sound a little elite to you, but we don't find representation outside in various places. We try to find representation on TV, in media. So in terms of surveillance, they've also been not been able to watch queer films and queer series, which has greatly impacted their mental health quite a lot. For queer people, the peer support that they get in colleges and workspaces is huge because biological family is a big threat for queer and trans persons. So for many people, staying with biological family might be a great idea, but for queer and trans persons, especially who are not out, it becomes very difficult to stay with parents. So in terms of support within the family, they are not getting that support. They are also not getting support with because they are away from the peer support groups. And many trans persons are also working class trans persons who run a regular like stalls, but because of the lockdown the stalls are now closed and the means of income has also gone. In terms of you know gender-based violence has increased. um, uh, Trans persons are forced to wear clothes that do not assign they do not prefer. Trans persons are called by their dead names so often that they feel so dysphoric about it. When they come out, at least they get to hear the name that they have chosen for themselves with their friends and peer supports. There are marriage proposals coming for queer women through internet, and parents are forcing the girls to meet the grooms via internet. And thanks to internet technology, now we can meet grooms online. So this has happened, and it is quite scary actually. It is life-threatening for queer people and trans persons during this COVID-19 situation. Yes.
Thank you, Rituparna. It's really sad and scary, as you have pointed out, to think that a community that is already marginalized at so many levels, how it has only multiplied. Uh, And you've talked about low-income trans communities and the specific challenges they face. So I wanted to come to our next speaker, Grace Banu. So Grace, given that you have been working specifically with low-income trans communities in rural Tamil Nadu, so what are some of the challenges that you have kind of encountered in terms of the work that you're doing? Yeah.
Basically, as Rituparna said, uh, uh, most of the trans people we are doing baking and the sex work, and some trans people are only doing work in the public sector and the private sector, and some people are doing folk artists, folk dancers, folk singers. So this kind of categories are there. So in Tamil Nadu, specifically rural area, trans community people, we are doing baking, not sex work, because the village circumstance doesn't allow to do the sex work. Uh, so they mostly they are doing baking. So all the shops are closed and completely a lot of the districts are completely locked down. So we totally inside the home. So we don't have any resources to earn. So it's completely horrible time to get. And rural area trans people, we have HIV infected trans people, and we have elderly trans people, and we have sugar and diabetes trans people. So we have to support their medical health, and we have to support their food and rations and everything. And yeah, uh, so we are facing challenges means the when we go to the when we go to the support, a lot of the policemen ask their behavior, it's completely rudely. And most of the police department people have transphobic thoughts. So already we have the lot of violence, and we are facing lot of violence through the police department. And this time they are doing extremely, and they are asking lot of stupid kind of questions, and they can't change their mentality.
Thank you, Grace. I think what that shows us is also, I think the COVID-19 crisis has also exposed some of the deeper fault lines, not only within our movement but also in the larger society. And on that note, Anish, you've been doing some of the work in Mumbai, and like how do you see the community, especially queer and trans people, uh, from different intersectional backgrounds and low income communities? How do you see them coping at this point?
So, Rafiul, I think one of the biggest learnings with the current situation we found ourselves in has been that we have to stand up for each other this time. And I think the past 6 months, which have been months of intense activism, ever since, you had the CA, NRC conversations and other sort of social movements happening across the country, you've seen a lot of different groups coming together and speaking up for each other's rights. And that sort of seamlessly transitioned into the fight against COVID-19 as well. And so a lot of queer and trans people are at the front lines providing relief, not just for queer and trans people, but for everyone on the field right now, and vice versa. You're seeing a lot of the discrimination barriers being broken down. I think Grace and Rituparna have covered most of the sort of challenges that are being faced today. But I also think a couple of other challenges that come up include access to ART medication for those living with HIV, and also situations in which there are trans people who don't live in gharanas and therefore are in smaller clusters that are harder to get to. I think currently a lot of our work has also been on trying to find more sustainable models to take this forward, because we've realized that private fundraising can only go so far. And so we're trying to get the Maharashtra government to actually provide for rations for the trans community across the state in some sort of systematic manner. And we're hoping that that's going to pan out, because the way the lockdown is continuing, especially in Mumbai and Pune, it's going to be incredibly difficult for any private fundraising to meet the need in the month to come.
Thank you, Anish. I also see that, even, and this is a conversation I was having with Rituparna the other day, that even in this moment of crisis, I see the queer community, coming together and finding that ray of hope. And I think it's not only within the queer community. I mean, across the board, we have seen the kind of solidarity. I mean, social distancing, but social solidarity. I mean, I think that's just so wonderful. And with that, on that note, I mean, I would like to move on to the next set of questions that I have, which is exactly about the response and some of the wonderful response, I would say, even in these times, very, very difficult times that we've seen coming from queer people. And going to Rituparna, your organization, Nazariya, does a lot of work specifically with the trans men community. And we also know that a lot of them come from low-income communities. Some of them do work that are not possible right now. The mobility has been restricted, right? So what have you done as an organization so far? Like, how are you kind of engaging these communities in these difficult times? Yeah.
Yeah. So basically, so in terms of relief work, there are two ways to look at it. One is in terms of mental health support. So we have been providing free counseling for queer and trans persons across India, which has increased now, and we have been able to cater to a lot of people who are breaking down during this crisis. Secondly, in terms of relief work, we have not been able to, trans men community is a very invisibilized community, and it's very difficult to 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 actually locate some of them. But we did a small fundraiser, and we could provide money for 3 months for 11 trans men and their partners and families. And we are planning to do one more fundraiser in the next month also, because now after the first fundraiser, we have been getting a lot of calls from trans men and their families to support them. We also understand that many queer women are also from working class, but it's difficult to locate queer lesbian women in this crisis. But what we are trying to do is that we are trying to locate queer women, queer lesbian women during this time, and also do a second round of fundraiser for them, and to sustain at least for 3 months, because this pandemic is not going to go easily soon. Yeah, that's what we have been able to do.
Thank you so much, Rituparna. Grace, when I last spoke to you, you said that your organization was running a campaign to support transgender folk artists. So could you tell us a little more about that and some of the other initiatives that you've undertaken? Yeah, in rural Tamil Nadu.
Yes, that campaign we did, me and Anish did, because as I said, the Tamil Nadu rural area trans community people, they are doing folk dance, and they are performing a dance in the temples, and this is the festival time to them to earn the money to sustain their life, like. Every year, this 3 months, March, April, and May. And this 3 months, it's completely locked down. Their livelihood is completely stopped. So that's why we did the campaign, and we support 75 transgender folk artists. Uh, and the needs, now we have another list also, because the needs are more. We need more support, and people are asking more support, you know uh, because the rural area trans community people, nobody can reach them because the village setup is it's so far from the city, and they are struggling a lot. And we are doing door delivery, and we have the motorcycle, whatever people ask the needs, we are giving the door delivery.
Thank you, Grace. Anish, in this regard, I mean, Grace already pointed out that you were also part of that campaign. And what I have observed is that the Pink List has been doing some amazing work, in terms of also collating information. And recently, you put together a list of NGOs that are supporting queer people and trans people in this time. So could you tell us a little more about, about some of the initiatives that are in place right now and some of the work that you have been doing as well?
So separately on the ground, I'm part of an organization that's just come up with the pandemic called Youth Feed India. So we've been doing a lot of cross community relief work in 6 cities across the country, and I'm leading the Bombay chapter with another friend, Nabil. Uh, with the Pink List, we actually started our entire queer relief initiative. And the idea with that initially was to ensure that all the queer fundraisers that are operating across the country get put on a single platform. Because even within a lot of fundraising platforms, even within a lot of spaces, these are sort of the fundraisers that get invisibilized and then don't get looked at. And especially when you look at smaller grassroots organizations, right? Your larger organizations often have the bandwidth or the wherewithal to raise funds, but a lot of these smaller organizations that do work at the ground level fall through the cracks. So we got around more than 20 fundraisers, Rituparna's, Nazariya fundraisers on there, Grace's fundraisers on there. A lot of queer fundraisers across the country are on there, and it's a crowdsourced sort of open list. If someone sends me a fundraiser, it goes up there. We're also trying to do some sort of emergency SOS relief work, uh, more so in Maharashtra because that's where we're sort of more equipped to tackle these SOS situations. So we've been able to get through the government networks rations and other supplies to trans and queer communities in the state. And finally, we've been doing this very exciting project with a initiative called Helping Hands run by NIFT students, where we're providing masks to the queer and trans-led relief workers in Bombay and Hyderabad. So we've been able to do around 1,500 masks in each city and sort of trying to do what we can. We just launched our mental health list today of around 50 queer-friendly mental health practitioners across the country who are offering either pro bono or reduced rate services during this time, which has again been a key concern that a lot of people have written in with, saying that we need someone to talk to. So a bunch of things happening around the place, but again, we're collating the information. All the work is being done by incredible people on the ground, including people like you, who's running an incredible fundraiser in Meghalaya.
Thank you so much, Anish. I would like all of everyone joining this live today. I would encourage you to go check the Pink List on Instagram. They are the stars. So, and it is actually incredible to see that, I mean, even my knowledge is so limited, but to see that so much is happening. And I think that takes me to my, kind of the last point that I have for this conversation is about imagining alternative ways of advocacy, because nobody expected this moment, right? In the movement, like we've had so many other conversations, law, health, but here is something that has like just put us all on the back foot. And so, Rituparna, coming to you, how do you envision, community organizing in this times when we know that community is so central to the work that we do? How do you see community organizing in times of social distancing? I know that Anish has pointed out some of the work that's being done, but what more needs to be done? Yeah.
See, Rafiul, social distances is something which we really don't like. We always crave for skin hunger, a hug, a touch from a friend. So social distance is something which is, of course, we understand alienation, we understand isolation, but once we get the community, we love to like we'll go and hug each other. There's this touch there is this there's this coming together of uh, queer people. So now, because of social distancing, what efforts are being could be seen in the LGBT organizing? I think we have to rely now unwillingly on the internet quite a lot, which we understand that we are leaving out quite a lot of trans people, trans persons, and queer persons from this internet, because they do not have access to net, or they do not have access to the language that we speak. But what we do in Nazariya is that we organize Zoom meetings every Saturday, a safe space for LGBT persons. So that at least we see each other, we love with each other. We spread love with each other. I think that's what we have been doing in terms of in times of social distancing. And how do we see it taking forward? I think we need to talk a lot. We need to send a hi and hello to everyone once in a while, because we all are isolated. We know how it feels like to be isolated, to be alienated. A hi, hello wouldn't matter. And that's because that's how the LGBT movement started, by socially getting acquainted with each other. I think that's what we need to do, and also to put pressure on the government to uh, to have an inclusive policy while doing relief support work for queer and trans population. I think that's what I have to say.
Thank you, Rituparna. I think, I was about to mention the Zoom meeting that you've been doing, and they're so exciting. I wanted to join. I haven't been able to join. But I'm sure the next one you're planning is a potluck. So I'm excited. But I think you made a very important point about even how, the internet, of course, has been a boon in many ways, but there are also limits. And coming to Grace, I wanted to know if these are some of the techniques that you have used, or if there are other ways at this point, you are finding hope and, optimism in this crisis with your community. Yeah.
As Rituparna said, we met our community and we share our love and solidarity to each other, and we give a hope to come back the normal the life, and most of them are especially that rural area trans community people, already they have so much love, and this is the time to share they're allowed to each other, and they are supporting each other, and we are staying together. And for example, for example, I'm staying in the Tuticorin district. In my house we have more than 17 trans people staying together, and we are sharing our love with each other, and each and every houses have. Here we have 15 houses, and all the 15 houses have this kind of this amount of trans people.
Thank you, Grace. I think that is important, that in this moment we are all in our own ways, and in different ways we are finding meaning and hope, and coming to terms with this lockdown, which I also don't have a clear idea. Sometimes I think this is actually a moment for all of us to introspect, especially those of us who are more privileged, to think what we have taken for granted. And sometimes relationships are so central to our life. So moving forward, this is my last question for Anish. Um, and this is something that I just mentioned. So Anish, I know these are very, very difficult times. I know there is a lot of news about sadness, despair, disease, death, all of it. And for those of us who have been in the movement, we know how we associate how the movement has been so, it started with HIV. In many ways, it is so linked with the deaths that happened due to the HIV pandemic at one point, right? To where we have come today. What is that, what do you see as a hopeful thing, in this moment of crisis? I mean, what is the hope here? Yeah.
I mean, very difficult to find hope, no, right now. But I think what Rituparna said, right? I think this is also a time when a lot of us are finding comfort, love in digital spaces, and we're looking to the internet to do things that we possibly couldn't earlier. And I think it's been a space and a time when a lot of us are finding time to reconnect to queer activists, to other people from across the country, time that we never had, time that we were too busy spending in our own areas. And it's opened up the space for sort of collaborative work that can be the model moving forward. So I'll give you an example. Right now, we're doing a hackathon with law students from across the country after what happened at National Law University, Jodhpur, where there was a professor who distributed homophobic teaching material. So in response to that, we're getting a bunch of law students together and doing a model anti-discrimination policy hackathon. Now, in a normal course, getting so many people together in one place at one time and doing it online, you just wouldn't have the energy to invest in that much effort. But now that online is the only option, you're sort of putting in the energy, putting in the effort, and making it happen. So I think that's exciting, seeing where we go from here, what we can do, and innovating and doing jugaad to find out how to get through this, I think is something that keeps you busy and also hopeful that despite all of this, we're still finding ways to make it work.
Thanks a lot, Anish. This has been like a wonderful session. And I have a couple of questions that I would, I'd like to, because we do have some time and I thought I could bring this up. And this is again for Rituparna. And Rituparna, a few days back, you and a couple of other people came together with a resource for people in these times, who are navigating difficult relationships with their families. So could you talk a bit about how, for anybody watching, like, how people could navigate some of the interpersonal dynamics, especially in homes,
I can't hear you, Rafiul. Something wrong with the mic. Can you
am I audible now?
Yes.
Yeah. So what I was saying is that you created a resource guide for people a few days back, that you and few other organizations that created this. Do you have some tips for people who are navigating difficult relationships with their families? How do you think what are some of the tips that you would give? Yeah.
So what we did, not as an organization, but some of us in the community came up with a guide, like a guide, not guidebook of sorts, but like guide to take care of oneself during COVID. So we talked about some grounding tips about how to stay grounded, how to not talk about gender sexuality issues while they are being at home, while how to not how to make an exit plan if there is violence at home. For instance, send your WhatsApp number to your send your WhatsApp location through your friends. Grounding techniques like art therapy, music therapy, talking to a friend once in a while, exit plan in terms of put some money in your pocket, get all your IDs together. If you have to run, make a list of organizations that you will like contact. I think these are some of the lists that we prepared along with other activists across the country. And yeah, this is what we also tell our clients who call us.
Thank you, Rituparna. For those of us joining us live right now, we've also been running this interesting portrait series on American Center New Delhi's Facebook page, and the theme is practicing self-care and kindness in this time. So this is a question for Grace. Grace, I know you do a lot of hard work. You have been, in the forefront of a lot of organizing. But when it comes to yourself, what is that one thing that you do to tell yourself that you have to take care of yourself and that you're special in this time?
See, here a lot of places are there, and when I go to do the relief work, and most of them are villages, and that villages it took around from my home to that village, it's minimum 20 to 15 kilometer far away from here. So we have a motorbike, and we are continuously a lot of rivers are there and a lot of wells are there, and I took self care to take a bath, nice bath, and you know, yeah, take a pure air. So these are my, and we pick the fish in the river, and that are the self care of to myself.
That's amazing. I'm so happy to hear that, and I think that's something I have been doing because I am home in Meghalaya right now, away from Delhi. And I realized that there is this beautiful hill behind my house, which I generally don't go for a walk. But these days I have, and mostly it's isolated. So I've made it a point to go there for a walk in the morning. And I think I'm prioritizing my health and, just caring for myself. So moving to Anish. Anish, I mean, we in the movement we do talk a lot about uh, intersections, about building alliances. So at this point, and we have also seen that kind of solidarity and very natural sort of cohesion between movements happening. So how do for those watching this live, how do you think allies can play a more supportive role, especially in these times?
So I think it's been an interesting space for allyship, right? So one is by sharing all the efforts being taken by queer and trans-led fundraisers and other organizations across the country. That's incredibly important because it is, after all, a community effort, and it takes, every small donation, every small token counts. I think the other form of allyship is also sort of stepping up and making your institutions queer friendly. I think right now we've seen a lot of people reach out to organizations and government organizations being like, this is the time wherein if you're a politician, if you're a corporator, if you're a IAS officer, do you know how many queer and trans people there are in your constituency, in your area? Do you know whether or not they have access to ART? Do you know whether or not they know how to get to a hospital? And it's almost, I'll give you an example. In Bombay, we've been facing this quite a lot, right? Bombay, the census population and the real population is a big difference. The census population will tell you one number, the real population is much higher. And in this time, we've seen the sort of a real population come out of the woodwork, almost the real population that has been invisibilized. And that's also true for queer and trans people, because very often, as time goes on, people sort of forget that queer and trans people exist. So you never think about where the trans people who had the signal begging have gone. and suddenly it's almost as if they never existed. And that's happened a lot with migrant labor. We've realized that there are a lot more people working in the city than we thought were working in the city. That's been the case with a lot of informal housing, where we've realized that factories, etc., have more people than we thought they did. And that's also completely taken all the institutions by surprise, because they're like, we thought there were 6 lakh people we had to feed in this area, there are 15. And so I think allyship also means that while you are expanding upon your imagination of what it means to reach out to everybody, feed everybody, take care of everybody, think about the sort of invisibilized queer presences around you, and ensure that whatever you do, you take those into account.
Thank you so much, Anish. Definitely, I think we can all do our part. And one of that is also informing our friends and allies about what they can do, right? And I think with the pink list that is already happening, Grace, before we close the conversation, I wanted to ask you about something very important. And I think if you have a request for people watching the live, you said that the government of India is seeking feedback on the Trans Act right now. So, and we know that it's a very tight deadline. I think it is 30th of April. So, do you have something that you want to share? Like you could request people, and and I mean, what can we do at this moment? And what can allies do as well? Yeah.
Yeah, yes, of course. This is the pandemic time, and we are in the emergency situation, and uh, we are fighting for hungry, and we are most of them are don't have anything, food, anything. We are fighting with our livelihood, and now this government asking the feedback of Trans Act, and this is very horrible time, and we strongly oppose uh, this commands, asking the commands, and it's not a right time to ask this, and government should take back the steps to do uh, do more, and we don't accept, and already we don't accept the transact. We are opposed the transact from the beginning onwards, and now they are asking the command for the community, and people are dying. You should concentrate, and you should protect them. That is your duty, and that is the priority to protect them. And I'll say, if I have to leave now, so after that only you should raise the commands. And when if I died, and your act for whom? So it's not correct time to ask this, and we strongly oppose this.
Thank you for making that point, Grace. And I also think that I mean, we should oppose it and also work uh, with other organizations and see how we can put the pressure. And of course, like as we have all seen that because of COVID-19, our priorities have shifted. So I hope that we will not, as a community and those who are our allies, I think we should not forget that justice has to be central to our work and organizing. We have very little time left, but I think this is a question I already asked and Anish has already answered. But so this is for Rituparna. I will close with this. So, what is one thing that gives you hope at this point?
One thing that gives me hope at this
Yes.
time is that despite whatever uh, animosity we have with each other, whatever political difference, not in terms of other political difference, but also in slight political difference that we have with each other, or we are at least saying hi to each other at this time. We are privileged enough to say hi to each other. We are keeping in touch with each other more than we actually kept touch with each other during non-COVID times. This gives me hope, and the kind of response that the community, that the trans community got for the delay, for the against the Trans Act was huge. And even during this time, 2000 plus members signed the petition to the government. It was huge. I think these are success stories that give us hope and say that COVID or no COVID, this community will thrive towards bringing justice and towards love. Yeah.
Thank you so much. I think justice and love, these are values that we all aspire for. And I'm so glad that even in this moment of crisis, we have seen, even if it's flickering, it's there, and we are all standing strong. I want to really thank all of you for, making time to speak to us today. And I want to acknowledge that this would not have been possible without the generous support of the US Embassy, and Swechha India, that has been incredible in helping us, live stream this on their Facebook page. And for everyone else, I would say that the campaign is still on. If you want to read some of the stories that we have featured as part of the COVID Kindness campaign, you can check out the American Center New Delhi Facebook page. You can also check out the Queer Muslim Project on Instagram, where we have been doing a couple of live sessions on different themes. And thank you, everyone, for joining us today.
Thank you.
Thank you.
Thank you, Rafiul.